This presentation today is really for you to give you background about how you can go out and train everybody. Okay, you already know how important AMR is, otherwise you wouldn't be here. So I'm not going to repeat this slide, okay? But we know what we want to do. The aim is to help your CCGs meet the quality premium and therefore to reduce total antibiotics and also improve the type of antibiotics that are being prescribed. So that means really for UTI, increasing nitrofurantoin and really thinking about when you should be prescribing, if you should be prescribing, and better prescribing, especially if you're querying pyelonephritis, and then in all those respiratory tract infections, reducing prescribing for that. So what this presentation is going to cover is a bit about the background as to why we have developed the Target Workshop as it is. So I'm going to give you a bit of background about the public attitudes to it, to antibiotics, the evidence to some of the approaches that we've used in the workshop, and really how we're getting you to go out and persuade your other colleagues how to improve antibiotics by really influencing their personal attitudes, the subjective norms. That's what I mean is what everybody thinks about you. So if we were to say what are the subjective norms in this room at the moment, we could say that one of them is that actually collectively you don't feel very confident at the moment about doing this presentation. What we're wanting to do is to change those subjective norms so you're all feeling a bit more confident in the other direction. So that's an example of a subjective norm. And then perceived barriers. What are the barriers to you changing prescribing? And one of the barriers at the moment is that we haven't got enough trainers like you who feel confident. So that's why we're doing this workshop. Okay, so, and we need you to consider what you're going to do when you leave. Not just about sore throat, not just about UTI, but actually how you're going to introduce this local plan. Okay, so first of all, we know that most of the general public are pretty knowledgeable and they know that most coughs and colds and sore throats get better on their own. They also know, they disagree with the statement because this is wrong. You don't need to finish a course of antibiotics. So they all know that. However, this is actually the percentage of a group that we interviewed last year about how many said they'd had an antibiotic for this particular condition last year. And as you can see, 46% of them said, of those who'd had an ear infection, had had an antibiotic for it. And also a skin infection, 36%, throat infection, 30%. Whereas we're saying that it really should be only about 10% of those that are having antibiotics. So people are overusing antibiotics. And so as a result, there's been this big campaign called Keep Antibiotics Working. Who've seen the campaign? Hands up. Okay, does that mean most people have seen the Keep Antibiotics Working campaign? So a lot of the target materials have gone into influence the Keeping Antibiotics Working campaign. So this autumn, when you see it again, you can say, well, I've been involved with that. I'm teaching the materials that are in the Keep Antibiotics Working campaign. So, that's really important. It's changing the subjective norms in society. So what are the patient's perspective towards antibiotics? Why are they actually, despite all of these campaigns, still coming to you for antibiotics? Well, we know that 56% of the population will say they've had an infection last year. And actually, many of them, contrary to what we all think, many of them actually look after themselves at home, as shown by this slide, you can see. But in red, you can see also that 20% of them contacted their GP surgery. So that's what we're wanting to reduce, because if they contact their GP surgery, they're more likely to expect antibiotics. So why do patients go to their GP surgery? And this is what they said. They said, well, we needed treatment. My symptoms were severe. you know, they perceive them as being severe, but obviously, as you know, one person's severe is somebody else's mild. They'd lasted longer than they expected, so that's something that we can tell them about. They were worried that the illness would get worse, so that's something else we can tell them about. They wanted to know the cause, and some of them, there's a substantial proportion who say, I always go to my GP with these symptoms, and you, I am sure, recognise that group of patients as well. So, what did they expect once they got there? And this is quite interesting. 38% expected antibiotics. So actually, if you think about that, overall, that's 8% of people who had a respiratory tract infection actually were expecting antibiotics. And so that's what we're wanting to change. But also, many of them wanted advice on whether they needed one, and the severity, and advice about the symptoms. So we know, actually, from lots of different studies, that if you can facilitate self-care advice and help those patients, they'll look after themselves at home, and you can reduce consultations. They don't always need antibiotics. And actually, you've seen this slide already, over 80% of the general public trust their GP. A similar number trust their nurse. But actually, as you nurses are becoming more into the prescribing arena, I think they're going to trust you much more about whether they need an antibiotic. So your job is to overtake the doctors on that thing, or at least match them. And interestingly, many of them trust the pharmacists as well. So we can also encourage patients to go to the pharmacy for advice. So as a result, it's worth sharing information with them. And we'll be going into that. So we've also, I think probably this has been mentioned, but I don't think it has been mentioned this morning because you didn't cover acute cough. We did cover CRP a bit, and one of you mentioned that you use CRP, but there is evidence that CRP, C-reactive protein, when used in the acute primary care setting, can reduce antibiotic use. But most importantly, improving communication is just as important. And as you can see, if you look at the different interventions, so antibiotics in usual care, 68% of them got antibiotics. If you give them communication training, 33%, CRP alone, 39%, and the combination of the both is 23%. So if you introduced CRP into a surgery area and you gave them communication training using the leaflets, then you could reduce antibiotics by over 60%. And that would be a big difference. And you've also discussed the booklet this morning, and that's been shown to reduce antibiotics by 50% and intention to reconsult by 50%. Now, delayed antibiotics, you heard about the acceptance of delayed antibiotics, and that about a third think they're a good idea, a third think they're a bad idea, and a third don't know. So we need to actually increase confidence in delayed antibiotics. This is the number who've actually received antibiotics, and delayed antibiotics, a delayed script, and it's only 5% overall of the total population. So we could increase that, but women is more than men. And actually what's interesting at the bottom is the acceptability. So of the number who actually got a delayed antibiotic, so interestingly, we interviewed almost 1,500 people for this study, and 165 had a delayed antibiotic, and 10 of the score of 10, 59% found that it was completely acceptable to have a delayed antibiotic. And there were very few at the far other end. So when actually offered it, people do find it acceptable, but they just don't understand the concept yet. So, you know, your job is to try and get people to improve. So you looked at the self-assessment checklist this morning. I want to just go very, very briefly through this. And green is really good. So these are some of the things that are on the self-assessment checklist. You've all filled it in first thing, didn't you? Yeah. And so you need to reflect really now on where you compare to the people here. Probably everyone in the room said they had antibiotic guidance, but how many, this one, actually, if you're here, you're probably done better than most of the people in this overall survey, because this is an overall survey of, I think, over maybe 1,500 people who've completed the online survey. Okay? And so if you look at this, only, it's about 50% had done an antibiotic audit in the past 2 years. So how many have done an antibiotic audit in the last 2 years? Now, you need to put your hand right up, because this is great that you've done it, okay? Okay, I don't know, it's about, 30% maybe. Okay, so, we can improve on that. Okay, what most practice should aim to do, and so this is, does a GP or nurse prescribed within the practice take a lead for antibiotic stewardship? So do you have an antibiotic champion? So this is, there's about 50%. So that could increase. So that's something that you could do and increase in your practice. Do you analyse and discuss antibiotic prescribing? This is about 70%. And I think that probably is increasing with the quality premium at the moment. And do you keep a written record of your surgery action plan? That's, about 60% for around antibiotic use. So that's something you could also definitely increase. But only 32% of respondents said yes to all those three. And then finally, what all antibiotic aware practices should be doing. So these are the ones who really are like you, who've come, you're really aware of what AMR is, you're going to be teaching everybody. So we want to see you have perfect practice, and this is what they are doing. But only 7.7% of GPs or the people who filled in this survey, actually fulfilled all these components. So this is a bit more challenging. So have you undertaken any antibiotic-related prescribing clinical course? Of course, by the time you've been to this today, you'll be able to tick that. So you're quizzing, aren't you? Do you have a strategy to avoid patients reconsulting with other clinicians? I think one person mentioned that as a real important thing. And do you regularly share patient information leaflets? So all these things are really important to consider. Okay, so what is target? We've said target is treat antibiotics responsibly, guidance, education tools. And this is the target website. Donna's going to go through that later on with you. Okay, so why have we developed it as it is? So if you think about somebody's behaviour, and in this one we're wanting to say the behaviour is, I want to use antibiotics responsibly. It's actually influenced by many different things. So it's your personal attitude, your own personal attitude, your peers' attitudes, and they can be peers in your family, friends, practice, CCG, nationally, Europe, worldwide, and perceived behavioural controls, and that's barriers to you doing it. We're going to go through those very quickly as I can, just to show you the things that do affect it. So the outcome, so personal attitude is divided into a few things. Outcome beliefs. So it's affected by, so this is, you've got to think in your head, my responsible use of antibiotics will make a difference to patients. So that's a personal attitude you have, that if you're not going to make a difference, and if your GPs and your other staff don't think they're going to make a difference by changing their antibiotic use, why the hell would they bother doing it? So that's why the training is important, to actually show them that it is important. to make a difference. And this is really an example. You saw the thing that actually, if you've got a resistant organism today, you're less likely to respond to antibiotics. You saw that in the UTI study. But this one shows you really what happens if you overuse antibiotics. And these countries in Eastern Europe with high erythromycin and really high erythromycin, clarithromycin use have rates of resistance of 50%. So you've got somebody with a skin infection who's penicillin allergic, and half of them you can't treat. Now consider what that would be like for you tomorrow in the practice. Do you think that's a scary thing? Yeah, good, right, excellent. Got you concentrating. Right, okay, so the next thing is, okay, attitude, rewards. Do you get any rewards? So what incentivizes us all? So obviously you get paid, but there's other rewards as well. And so, you know, you're thinking to yourself, if I prescribe responsibly, I will be rewarded for it. Well, this can be lower consultations, incentives, or your reputation. And this actually shows an example of how actually consultation rates are related to prescribing. So this is actually the number of consultations in blue for acute cough, cold and flu in the UK. And underneath is the rate of prescribing, and they're mirrored exactly. And so if you actually decrease consultations, you decrease prescribing. Or if you decrease prescribing, you reduce consultations. They're all related. So in this study, those practices who reduce their prescribing reduce their consultations. So patients can be retrained not to expect antibiotics, and you can reduce consultations and spend your time doing something more valuable. So that's an incentive for you, because you're going to get less consultations for acute cough and do something else. The other incentive for the CCG will be the QP. So what about subjective norms? So these are the peer beliefs. My peers also believe in responsible prescribing. So how many of you think that the rest of your practice believes in responsible antibiotic prescribing? Is there anyone who doesn't think it's important? Okay. So the next thing is, did somebody discuss antibiotic prescribing in the last 6 months at a practice meeting? How many of you didn't? So there's still a few of you. So that, you know, may not be quite so important if it's not been done for 6 months. So the importance of the team approach is here. So if you do anything in the practice, or if we go into practices, we always get the whole practice team involved. Okay, so you invite everybody because everybody's involved. The receptionists are involved with triaging patients now. You've got healthcare assistants who take triage for UTI. All of the prescribing team. You've got everybody who's involved. But also, you need to also consider your out of hours. You need to consider inviting your local community pharmacist to your meeting as well. So all of these different people who were involved nationally. And also your dentists, because one of the things for dentists is acute dental pain. Okay, so the next thing, subjective norms. The subjective norms in an area are affected by the motivation to comply. And so I want to prescribe responsibly because my peers would want me to. So this can be locally in your CCG, in hospitals. It can be across countries. So an example is recently, the European Commission for Disease Control recently visited the UK to look and see how we were doing with our antimicrobial prescribing. And they said, you're doing very well compared with your peers. So we're all very proud of ourselves. But they also visited a practice in Gloucestershire. So, you know, and they were really impressed. So, you know, Gloucester were really proud of themselves as well. So presenting local data is really important. So presenting local data is really important. So here we go. This is the data, and we're going to show you how to get it. But actually, when you talk to GPs, this is the thing, and GP staff, this is the thing they are most, this is the thing that influences them the most. They want to be down here on the bottom right. Okay? And CCGs do as well. Okay, so showing them the data is really important. So what about financial incentives? They can certainly be very effective while they're in place, whatever incentive it is. So decreasing total, or the 4 Cs, you know, the broad spectrums, which is in the quality premium, giving them bonuses to be in line with prescribing guidelines. And as you know, so that the QP, we've talked about that, that we need to reduce broad spectrums, trimethoprim, and actually the ratio of trimethoprim and nitrofurantoin is going to the end of this year, but then it will just be looking at nitrofurantoin. So also things that affect you, can affect the social norms, are audits and action planning. And we have lots of audits, and we also have the self-assessment checklist, so they can all be used to influence this. And what about motivating the public? So the public need to understand more that their own antibiotic use makes a difference to prescribing. And this is a really interesting technique that motivated patients in a practice in Haringey that won a BMA prize last year. In that practice, they did a computer prompt that came up when a patient had been prescribed an antibiotic recently, and said how many antibiotics that patient had been prescribed. So the GP, some people come back for repeat prescriptions, and it's not obvious to that general practitioner sometimes. So suddenly you're saying, oh, you've had amoxicillin 4 times already this year. Do you realise that? Do you realise what that effect that might be having on your gut flora? And that made a big difference to prescribing. Okay, also giving patients control through the backup prescribing also increases patients' confidence, increases their satisfaction, and also means they're less likely to consult. And so all of these leaflets are really important to give control back. But you need to share them in the consultation. You don't give them, you share them. Okay, so you can get them to come up and pop up on the computer system, and we'll talk about that. But you need to go through them. They're to share. Okay, they're not a parting gift. Okay? Okay, so self-efficacy, perceived behavioural control. So self-efficacy is, I have the confidence to prescribe antibiotics responsibly. So this would be knowledge and skills. So I'm hoping that after today you'll have a lot more knowledge and feel more confident about prescribing appropriately, and also then have the skills to go away and understand why we're doing these workshops. So how do we increase confidence and skills? Well, guidance is really the keystone to all prescribing and antimicrobial stewardship, because that is the knowledge and the background. And if you've got that in your practice and you give it to locums as well, then that is really important. Training really forms a background, and there's some really good, and it's free training which you can add to your CPD. There's not much free training available nowadays, and this can be done online, and it's available on the RCGP website. Okay, and then patients' confidence is also very important. So I think you've probably discussed this again already. So there's 2 target leaflets. There's the respiratory tract infection one, and these are available on EMIS. So is anyone at the Aspen Centre here? Yes, so you're at the Aspen Centre. So in the Aspen Centre, this is set up on the EMIS system. So it should be able to come up, and there are instructions on the Target website about how to do that. That's correct, isn't it, Donna? Yes. Okay.
Is it just the EMIS it's on? Not on
No, it's also on System 1. Okay? And there's instructions on System 1 as well. Okay, so all sections can be personalised, and that was important for patients. And if you use it on those systems, it becomes part of the clinical record that you've given it to them, and it will print out with their name on it. So I understand. Okay. It tells you how long the infection will last, because that was one of the reasons why patients were coming back. It gives safety netting advice, and the reason for that is that patients were worried about whether their infection was really severe, and we're worried about increased sepsis. It tells you about a backup prescription, because we know backup prescriptions can decrease antibiotic prescribing by 40%. And it tells you about antibiotics and resistance, because that is really important for patients to understand why they shouldn't be taking antibiotics. There's also all of these resources, and again, in the autumn, there will be a big Keep Antibiotics Working campaign, okay, so that you can all participate in that. And Donna Leckie has done some really good work with the videos in patients' waiting rooms. So if you have videos in the waiting rooms, and I know the Aspen Centre does because I was there, you can put videos up, and these are available on the website. And we've shown that if people watch the video and the video is on, and the seats are facing in the correct direction, okay, then they will change their knowledge. They'll have increased knowledge. You may laugh, but those things are really important. Okay, so external factors are still important. And I think you need to think about all the external factors: time, forgetfulness, the computer system, prescriptions, regulations, and patients, the cost, and their work. And one of the things that's really important is actually what is reported to you from the laboratory. So this is something that you need to consider with Philippa Moore, but I think Philippa Moore is very good at this. But this shows here, maybe I can show you, is there a pointer here? Yes. Right, so in this area here, in this first section, coamoxiclav was reported on all urines. Then they swapped to cefalexin, and then they swapped back to coamoxiclav. Now, if you consider that these two antibiotics are only used second line, it was amazing the difference that happened. So you've got here in blue, this is cefalexin, and so when cefalexin was reported, it went right up, and then it went down. And the opposite effect happened to coamoxiclav. So it started higher, and then when it wasn't being reported, it went right down, and then it went up again. So finding out, making sure that people that report the correct things is very important locally. So really, that's the most important thing, that we want to act as a team. So that's the sort of end of the introduction, to really tell you, to explain the purpose of the different parts of the website. People often say to me, okay, you've said all of that, but which is the most important part? There isn't a most important part. Unfortunately for you, you have to have all the components together. They fit together like a jigsaw. So you need them all. And you need all your team fitting the jigsaw together to make it work most effectively.